Welcome everyone to today's online lecture. Today we're going to be talking about trisomy 21, which is also known as Down syndrome, and today's presentation is created by Bushra Javed and Isha Jahan. So if you take a look at the left hand side, the red box is circling the 21st chromosome. This is the chromosome that's affected with Down syndrome. Down syndrome is the most common chromosomal abnormality. It occurs when there's a trisomy of the 21st chromosome. Typically, this condition is associated with physical growth delays, intellectual disability, and characteristic facial features. If you look at the right-hand side of the screen, you'll see that normally the 21st chromosome should have 2 copies. But with Down syndrome, you'll have a trisomy of the 21st chromosome. So this means you'll have 3 copies. Down syndrome occurs in approximately 1 in 750 live births in Canada. According to research done by Public Health Canada, there is an increase in incidence with advanced maternal age. This table compares the number of live births to Down syndrome births relative to maternal age in Canada. The blue represents live births and green represents Down syndrome births. It's clear that with an increasing maternal age, the percent of Down syndrome births also increases.
There are many different causes of Down syndrome. 95% of the cases are associated with maternal non-disjunction and advancing maternal age. Maternal non-disjunction is basically the failure of sister chromatids or homologous chromosomes to separate during cell division. 2% of the cases are associated with mosaicism. Mosaicism is when an individual has mixed chromosomal makeup, so some of their cells will have trisomy 21 and others will be normal. The remaining 3% of cases are associated with translocation. This occurs when there are 3 copies of the 21st chromosome, however, one of the 21st chromosomes breaks off and attaches to another chromosome. The first image represents maternal non-disjunction. As you can see, the chromosomes have failed to separate. The next image is of mosaicism. Mosaicism is when an individual has mixed chromosomal makeup. The orange in this image represents the trisomy 21 cells and the pink represents the normal cells. The last image is of translocation. In this situation, the 3rd copy of the 21st chromosome has broken off and attached to the 14th chromosome.
For the diagnosis of Down syndrome, multiple tests are required. A combination of lab tests, ultrasounds, chorionic villus sampling, and amniocentesis need to be done. Lab test results associated with trisomy 21 include unconjugated estriol, PAP-A, low AFP, elevated HCG, and elevated inhibin. Below is a chart that summarizes lab test results that are indicative of trisomy 21.
The sonographic findings for trisomy 21 vary throughout the pregnancy. For first trimester screening, the appearances associated with Down syndrome are a nuchal translucency greater than 3 mm, a hypoplastic or absent nasal bone, and abnormal velocity in the ductus venosus. During the second trimester, the soft markers include echogenic intracardiac focus, ventriculomegaly, and echogenic bowel. The cardiac defects in the second trimester include a tricuspid regurgitation, atrial septal defect, ventricular septal defect, and atrioventricular septal defect. Duodenal atresia, esophageal atresia, hydrops, and cystic hygroma are also associated with Down syndrome. It is important to note that you will not see all these sonographic appearances with Down syndrome. You will most likely see a combination of a few sonographic appearances. For example, you may encounter a combination such as a nuchal translucency greater than 3 mm and an echogenic intracardiac focus. At this point, further investigation is recommended. This is an ultrasound of a normal fetus and a fetus with Down syndrome. In the normal fetus, you can clearly see the nasal bone and a normal nuchal translucency. The image on the right is of a fetus with Down syndrome. The fetus has an absent nasal bone and an increased nuchal translucency.
These are spectral traces of the ductus venosus. Normally, the ductus venosus has forward phasic pulsatile flow, but with Down syndrome, there's reversal of flow during atrial contraction. Other sonographic appearances associated with Down syndrome include ventriculomegaly, cystic hygromas, atrioventricular septal defects, echogenic bowel, and hydrops.
2 common differential diagnoses for Down syndrome include Edwards syndrome, which is trisomy 18, and Pateau syndrome, which is trisomy 13. These are differentials because they present with a similar lab test results as Down syndrome.
Some complications associated with Down syndrome include heart defects, hearing problems, acute leukemia, endocrinal problems, hyperthyroidism, immunodeficiency, renal anomalies, and infectious diseases. Do note that all of these complications may not be present in an individual with Down syndrome. The prognosis varies for each individual depending on the severity of the condition and the complications associated with it. Typically, the median lifespan associated with Down syndrome is approximately 49 years. Other individuals are going to have varying degrees of mental deficiency and hypotonia, but mortality is associated with individuals with cardiac defects. So that brings us to the end of the presentation. Thank you so much for listening, and these are some of the references that we used.